I am excited.
Okay.
Looking at all these pictures created by you, and you are a world record holder.
Okay.
So I feel not only excited, but really privileged. Really privileged.
Thank you.
Congratulations. You are in work, and most of the time you are sitting. So, are you taking care of your health? Because exercise is important. I can see that you have almost an ideal body weight. Good. You haven't gained any weight. So, that is something very positive. So, how do you maintain your health?
ഞാൻ 25 വർഷമായിട്ട് ഡയബറ്റിക് ആണ്. ഇൻസുലിൻ എടുക്കുന്ന ആളും കൂടിയാണ്. കുറേ ജീവിതത്തിൻ്റെ പ്രോബ്ലംസ്, പക്ഷെ അതിലെല്ലാം മെയിൻറ്റെയിൻ ചെയ്ത് പോകുന്ന നമ്മുടെ ഈ ആർട്ട് വർക്ക് തന്നെയാണ്. അത് ചെയ്യുമ്പോൾ കിട്ടുന്ന ഒരു റിലാക്സേഷനും അതുകൊണ്ട് നമ്മൾ പല കാര്യങ്ങളും എന്താ പറയുന്ന ഓർക്കാതെ പോകുന്നുണ്ട്.
അപ്പോൾ യുവർ ആർട്ട് ഈസ് ആൾസോ എ മെഡിസിൻ ഫോർ യുവർ ഡയബറ്റീസ്.
ശരിക്കും എന്നെ സംബന്ധിച്ചത് സത്യമായിട്ടുള്ളൊരു കാര്യമാണ്. പിന്നെ എനിക്ക് സാറിൻ്റെ അടുത്ത് ചോദിക്കാനുള്ളത്, നമ്മൾ ഈ ഡയബറ്റിക്കിൽ വരുമ്പോൾ 2 ടൈപ്പ് ആൾക്കാർ, അതായത് പെട്ടെന്ന് മെലിഞ്ഞു പോകുന്നവരുണ്ട്, അതേപോലെ തന്നെ വണ്ണം കൂടി വരുന്നവരുമുണ്ട്. അത് എങ്ങനെയാണ് ഇതിനെ ഒന്ന് താരതമ്യം ചെയ്ത് നമ്മൾ മനസ്സിലാക്കേണ്ടത്?
അതായത് സാറിന് as you know, overweight and obesity is a huge public health problem in India. It is a burden for us. So whenever somebody is overweight and obese, that means he is not only going to develop diabetes, he is also going to develop so many other complications. And that can include sleep apnea, pain of the joints, arthritis, and even cancers. And obesity is one of the main reasons for the development of chronic kidney disease, renal failure, dialysis, stroke, and of course, diabetes and obesity. It's a combination. It is a deadly combination. And that can result in heart attacks. In Kerala and in India, these complications are very high, extremely high complications. As you said, there are people who are very lean and there are people who are overweight and obese. And lean people, of course, we believe that they are healthy, but you know that I am overweight. Do you believe that? Yeah, normal weight alla, overweight aanu. That you can be lean, but even minimal occurrence of fat over the abdomen. നമ്മൾ കുടവയറെന്നൊക്കെ മലയാളത്തിൽ സന്തോഷപ്പെട്ട, that can also actually be a risk factor for the development of all these complications. The message is, you need to maintain an ideal body weight. Whether you have diabetes or don't have diabetes, you need to maintain an ideal body weight. So how do you maintain an ideal body weight? Is it because of your art?
Correct. ആർട്ട് തന്നെയാണ്.
Do you do exercise daily?
എക്സസൈസ് കുറവാണ്. അപ്പം ഞാൻ അതും ചോദിക്കാൻ വേണ്ടിയിട്ട് വന്നു. അപ്പം നമ്മൾ ഈ ബോഡി വെയിറ്റ് ഉള്ളവർക്കും ഈ ബോഡി വെയിറ്റ് കുറഞ്ഞവർക്കും ഡയബറ്റിക് ഏതെല്ലാം എക്സസൈസുകളായിരിക്കും സാർ സജസ്റ്റ് ചെയ്യുന്നത്?
Yes, it's a very important question. First of all, Prince, what I would like to tell you, because you are a God-gifted person. Because God has gifted you, and that is why you are a world-renowned artist. So you need to live longer. But when I am requesting and when I am wishing for living longer, the wish is to live longer, retaining the health. We shouldn't be bedridden. So when you are treating diabetes, if you are exercising regularly and if you are maintaining the ideal glucose levels, and then you are having a normal weight, that is good. But there are many people who are losing weight because of uncontrolled diabetes. These are different. So when you are controlling diabetes and when you are exercising regularly, if you are maintaining the ideal body weight, that is the best scenario. So when I say controlling diabetes, that includes multiple components. Number one component will be measuring the glucose at multiple points of time and keeping it normal. Normal for your diabetes and for your age.
Okay.
And then the second is controlling the cholesterol levels, controlling the lipid levels, and almost all these BP levels, preserving the kidney, preserving the heart. All these will require nowadays medications.
Okay.
Because it has been proven that only a couple of medicines can protect all these organs. And there are a couple of new group of drugs which are specifically given for diabetes to protect the heart and the kidney, because these are the two major organs which can develop complications, and these are all very expensive complications. So if you ask me what sort of an exercise can I do, the answer is that depends upon your age, that depends upon your age of diabetes, and that depends upon the current scenario of your organs, whether your liver, heart, kidney, your muscles, brain, all of them are normal or not. So we do a series of investigations and then we'll let the patients know how much of exercise we can do. For example, you cannot go for a severe exercise if your diabetes is not controlled.
Okay.
If it is only controlled, you can go for a good exercise. The best thing about you have told me that you are on insulin. So I think that is the best thing you have done. Because even though you have many medications for diabetes, you can have oral medications, and you should be having oral medications, not only insulin, but a combination is better than only one drug. So we are on the right path. More than 20 years of diabetes and still doing well. But anyway, we have met. And then, do you have anybody who is overweight in the family?
ഫാമിലിയിൽ ഓവർ വെയിറ്റ് കുറവാണ്, പക്ഷേ എങ്കിലും ഫ്രണ്ട്സുകളൊക്കെ എടുത്തു കഴിഞ്ഞാൽ ഓവർ വെയിറ്റ് ഉള്ള ഒരുപാട് പേരുണ്ട് എനിക്ക്. അപ്പം അവർക്കൊക്കെ കൊടുക്കാനുള്ളൊരു സന്ദേശം കൂടി ഒന്ന് ചോദിക്കുകയാണ് സാറിൻ്റെ അടുത്ത്. നമ്മൾ ഡയബറ്റിക് ഓവറായിട്ട്.
My humble advice will be, with overweight or with obesity, they should be having an adequate sleep. Very important.
Okay.
Sleep is important. The anxiety, stress level should be controlled.
Okay.
Very much it should be controlled. And then another advice is, if they are going for a diet or exercise for reducing weight, they should be meeting a expert doctor and get advice. And only based on the expert advice, they should be following a diet or exercise. The reason being, whenever somebody is losing weight based on a diet, they will lose weight. But after a couple of months or years, they will start regaining weight. And sometimes that regained weight will be more than the weight they have lost. If they are not going by a scientific advice, then the regained weight will be more depressing for them. So now the experiments and the current research is focusing on how to maintain the lost weight. If you have a close friend, I know that you are having a small daughter, and your idea and objective should be, she should not be overweight. So, and she should not develop diabetes. And if you can do something right now when they are small, that is the right time where you can have some plans executed, some of your projects executed. I say project because it is a project by itself, because diet, exercise, sleep, reducing the stress level, that can start from early childhood onwards, so that you can prevent obesity, you can prevent weight gain, and you can even prevent diabetes. So that is successful. So are you getting an adequate sleep? Are you sleeping adequately? How many hours you sleep daily?
6 hours.
6 hours. Better to sleep for 8 hours. 8 hours sleep will be better than 6 hours. And that 8 hours sleep need not be at one stretch. It can be divided into different compartments. You can sleep during the night time, and then 1 or 2 times, or once after a meal, lunch, you can have a nap. So the total duration can be somewhere between 7 and 8 hours. That is also good for maintaining an ideal body weight. Thank you, sir. Thank you.